Well, first of all, you're always going to have some small percentage of the people who are going to have tremendous needs because they're going to be sick, they're going to have diseases, they're going to have conditions. I will tell you that my oldest child was born with spina bifida, and before she was 5 years old, she had 5 brain surgeries. I mean, tremendously costly. Well, guess what? If I were on Medicaid and my family was on Medicaid, that would be a cost visited upon the Medicaid system. But it's not a cost that we should avoid at the, so that she goes without the care either for any child in the state of Louisiana. I will tell you what we need to do with respect to the Medicaid program is we need to do the Medicaid expansion. We do not have a business plan for our private partner hospitals that doesn't require Medicaid expansion, because 75% of the current reimbursements we get for the uninsured in Louisiana will be reduced will be cut by 75% by 2020, because we were supposed to reduce our uninsured population by 75%. If you don't do the Medicaid expansion and you lose 75% of your current reimbursements, you have no way to pay for the health care that's going to be delivered to this particular population. And when that happens, it isn't just, the poor people, it isn't just the uninsured, it isn't just the Medicaid population that are going to lose access to health care services. When a hospital closes, it closes for everybody. We've recently seen Baton Rouge General in Baton Rouge, the downtown hospital, the one closest to the state capitol, close its emergency room because too many people were coming through the doors without reimbursement following them. So I believe we need to expand the Medicaid program. It would have saved us $52 million this year. That's the way the fiscal office scored it. We had a $1.6 billion shortfall. You would think $52 million would be attractive to some people. Well, it wasn't attractive to the majority in the legislature or to the governor. $16 billion worth of our tax dollars over 10 years. You can hire a lot of doctors and nurses and provide a lot of health care for $16 billion over 10 years. Instead, if we don't reverse course, that money is going to go out of state and it's going to provide for health care for the working poor of those states that did expand the Medicaid program, but not here in Louisiana. But those are our dollars. And by the way, this should not be a partisan issue. In fact, it really isn't. Of the 30 states that have done the Medicaid expansion, 14 are led by Republican governors. This is a matter of just doing right, I believe, and making your own tax dollars available to take care of people here, as opposed to continuing to allow our tax dollars to go out of state and take care of the people everywhere else. But if we will do that, we can expand the existing Medicaid delivery system, which in Louisiana has already been reformed. We no longer do fee-for-service here. We have a Bayou Health plan with 5 insurance companies between the state and the provider to manage people's health. It's a capitated program that we're managing health and we're saving dollars. And so if we believe in that model, I don't know why we wouldn't take the additional dollars and do the expansion and put the 250,000 working poor people in it. And we're going to have to do this, and I think it's a shame that we're waiting as long as we have, because we're going to miss the 3 years where the federal government was going to pay 100% of the cost. But it will never pay less than 90% of the cost. And we will build roads and bridges all day, every day for 90 cents on the dollar. But for some reason, we don't want to deliver health care for 90 cents on the dollar. Does it make sense to me? That would be one of the first things that I do as governor.